Hi everybody, welcome to another Chats with Chaudhry. I'm delighted to be joined by Colin Grant, who is the Director of Quality and Regulatory Affairs at Astrea Bioseparations. And today we're going to talk about the challenges of implementing a new GMP quality management system in chromatography. So first of all, Colin, lovely to meet you. How are you?
Not too bad, thank you. Yourself?
Very well, on a very cloudy day here in Surrey, I have to say. Hopefully the sun's shining in Cambridge where you are.
I've got a feeling we're very similar in this regard. It's very cloudy, but very good.
Right. Well, before we start talking about quality management systems and the implementation of them, perhaps you could tell people a little bit about Astrea and also your background and your role at Astrea.
Yeah, in Australia, we make affinity chromatography products and bioseparation products. And we've got 12 products that are used in pharmaceutical final products that have been approved by the FDA. So we're doing okay. We're doing okay.
Okay.
In regards to myself, well, I've worked in GSK, Thermo Fisher. I've worked in the oldest pharmaceutical company in the UK called William Ransom.
Right.
I covered small molecule, advanced therapy, medicinal products, and I've even covered herbal medicine. So this is a new area for me, but I'm learning fast.
Right. And how long have you been at Astrea itself?
Astrea since January 2015. So we've been working on our quality system since that time.
Right. Okay. So for those who are not familiar, what it actually is a quality management system? Why is it so important for a company like Astrea?
Well, the quality management system, it basically involves traceability and control. So it involves a number of different areas within that. I won't go through the whole details because it's significant, but it involves things like change controls, deviations, how we handle complaints, for instance, audits, both internal and external, training programs, building and maintenance. It covers critical equipment, document control, packaging and labeling. It goes on forever. Lab controls. I could go. Batch release and status control. There's so many things and areas. Right. But as I say, we're looking at all of these things.
Okay, and you obviously, as you said, joined a few years ago to implement a new QMS system within Astrea. So, why did you do that? Why is it GMP compliant? And what are the challenges that you face doing that?
Well, I could talk about a number of different factors within the challenges, but today I think that really what I think the main one was the quality manual for ourselves. It was more due to our approach. I wouldn't say that everybody would have this issue, but because we're looking to get to that GMP compliant stage, what we actually did is that we followed an approach whereby we replicated each section and subsection of the rules and guidance of pharmaceutical manufacturers and distributors, which is kind of like the Bible, the MHRA Bible for GMP. This set of guidelines we used to develop the management system. And what we did is we did a gap analysis when we did this. So it took us about 6 months because we had our normal everyday work job to do. But so we had weekly meetings whereby we would go to a different section. And what we did is that we made a common sense approach to how we went through each section. If we could do it, we put in how we did it. And if we couldn't do it, we put in the reasons why we didn't do it. So, so for example, QP, qualified person release, we don't need to do that. So we would just register the fact that the quality department would do the release side of that, and we would do a sign off, but we wouldn't need a qualified person to do that.
Right. Okay. And so looking ahead, if you were sort of talking to someone else, then what would be the biggest piece of advice you'd give them if they were looking to implement a new QMS?
I would start simple. I would start simple. I would start with a hard copy, and I know the first idea would be to get in an electronic quality management system, but work on your processes first. Quality is all about continuous approval. So first of all, what you want to do is document and trace everything that you do. Follow the process maps, make sure that you're getting there. We've now had the other thing, and this is quite important, and it kind of covers the ICH guidelines Q10, which is the International Council of Harmonization on Quality Management Systems. And it captures two things, GMP and ISO 9001. Now, we've been ISO 9001 accredited for 18 years, but with the GMP requirements, you can combine both of those, and you can produce a system that is compliant worldwide based on the ICH guidelines. So that's how we did it. But my advice is always keep it simple to start with, and then work it way up. So start with your documentation, start with your traceability, and then start to introduce risk assessments, start to introduce root cause analysis, and all these other maintenance control processes. And you'll slowly and surely expand, and you'll bring your people with you.
Right. Okay. And so, why has Astrea, chosen to manufacture absorbents according to GMP guidelines when many other manufacturers don't do that?
Well, I can't answer for other manufacturers, but in regards to us, it's because we listen to our clients' expectations, the needs. So, for example, our products, a product like PrioClear, it's used to remove prions from human plasma. And we approach it that our products could be used as a pharmaceutical product that can be used in a pharmaceutical product manufacturer, sorry. But if we're doing that, the products that come out of that end game, the final pharmaceutical product itself, our parents, our children, they can all use that. And at the end of the day, we want to have we want our clients to have safe programs. And well, quite simply, at the end of the day, GMP means good manufacturing practice. That says it all to me.
Yeah. Right, okay. And in terms of GMP API accreditation, is that something that Astrea are looking to achieve?
Well, we'll never achieve the full requirements of Part 2 of the guidance on API, which is an API is an active pharmaceutical ingredient. We're not an active. We do not provide any ingredients that go into final product manufacturing. But I had, before the Brexit and the COVID, I think we all know about this, I've been chatting to the MHRA, and we looked at they were already looking at companies that supported critical areas of pharmaceutical manufacturing processes. And that would mean encapsulate companies like ourselves. So I can't say when or where we'll be licensed, but I know it will happen at some point.
Right, okay. So you've actually got a webinar coming up on this, haven't you, next week, where people can find out more?
I do. So it's next Thursday, 30th of July, 3 p.m. I'm very happy for people to join in and ask questions, and if I've got any advice, I'm always willing to take it. So so please feel free to join, and that's my first as well, so you might see a few mistakes. So
well, this is your first video interview as well, so you've done very well. So I hope people can register for that. If you would like to register for that particular webinar, there is a link above the video which you can click on to register for it, and there is a link to find out more about Astrea as well, just below that link as well. All that's left for me to say is actually, Colin, thank you very much for taking the time out to do the video and tell me more about QMS. I've learned more this morning than I ever did about quality management systems. It's all been very interesting. Please make sure if you find that interesting to register for the webinar next week. And as always, Colin, thank you for your time.
Thank you.
And thank you all for watching. And as always, until next time, stay well and stay safe. Thanks a lot. Bye-bye.